A young civilian nurse walked into Fort Mason Military Medical Center with nothing but determination and a worn leather nursing bag. What she didn't expect was to face the wrath of Dr. Colonel James Hartford, the most feared physician in the emergency department. He dismissed her as just another inexperienced civilian who didn't belong in their world of military precision. But when chaos erupted and lives hung in the balance, this humble nurse would reveal a secret that would leave the arrogant doctor speechless, and everyone around them questioning everything they thought they knew about courage, honor, and the true meaning of service. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. Sarah Mitchell stood outside the imposing glass doors of Fort Mason Military Medical Center, her fingers gripping the handle of her father's old leather nursing bag. The Colorado morning air was crisp, and the Rocky Mountains loomed majestically. In the distance, their snow-capped peaks catching the early sunlight. At 24, Sarah had already graduated top of her class from Denver University School of Nursing, but stepping into a military hospital felt like entering an entirely different universe. The building itself was a testament to order and discipline. With its clean lines, American flags positioned at precise intervals, and the constant flow of uniformed personnel moving with purpose through its corridors. Sarah had deliberately chosen this path, turning down offers from prestigious civilian hospitals to work here at Fort Mason. It wasn't the money that drew her. The salary was actually lower than what she could have earned elsewhere. It wasn't the prestige either. Military hospitals were known for their rigid hierarchies and unforgiving standards. What pulled her here was something deeper, something she couldn't quite articulate even to herself. Perhaps it was the desire to serve those who served others, or maybe it was the challenge of proving herself in an environment where excellence wasn't just expected, but demanded. Whatever the reason, she knew this was where she needed to be. As she walked through the main entrance, Sarah was immediately struck by the controlled chaos that defined military medical facilities. The halls buzzed with activity, yet every movement seemed calculated and purposeful. Doctors in white coats moved alongside uniformed officers, their conversations a mixture of medical terminology and military protocol. The walls were lined with photographs of distinguished service members, their faces bearing the weight of sacrifice and honor. Sarah couldn't help but pause at one section labeled Heroes Among Us, where medals and commendations were displayed, behind glass cases, each telling a story of extraordinary courage under fire. The smell of antiseptic mingled with the faint aroma of coffee from the nearby break room, creating an oddly comforting atmosphere despite the underlying tension that permeated the space. Sarah had read about military hospitals, studied their protocols, and prepared herself mentally for what she would encounter. But experiencing it firsthand was entirely different. Every sound seemed sharper here, every decision carried more weight, and every mistake could have consequences that extended far beyond the hospital walls. Making her way to the emergency department, Sarah noticed how the civilian staff moved differently than their military counterparts. There was a subtle deference in their posture, a recognition that they were guests in a world governed by rank and tradition. Sarah straightened her shoulders, reminding herself that she belonged here just as much as anyone else. Her nursing credentials were impeccable, her knowledge extensive, and her commitment unwavering. Yet, as she approached the nurse's station, she couldn't shake the feeling that she was about to enter a battlefield where her weapons would be compassion and competence rather than strategy and strength. The emergency department at Fort Mason was unlike anything Sarah had encountered during her training rotations. The space was larger, more organized, and infinitely more intense than civilian emergency rooms. Multiple trauma bays were arranged, in perfect symmetry, each equipped with state-of-the-art medical equipment that gleamed under the fluorescent lighting. Charts and protocols were posted at every station, their military precision evident in the way information was categorized and displayed. Even the color coding system seemed more sophisticated, with different hues indicating various levels of priority and urgency. Sarah approached the main desk where several nurses were busy with their morning preparations. Their uniforms were crisp, their movements efficient, and their expressions focused. She cleared her throat softly, not wanting to interrupt what appeared to be an important briefing about the day's schedule. One of the nurses, a woman in her 50s with steel gray hair pulled back in a perfect bun, looked up from her clipboard. Her nameplate read, P. Wong, RN Supervisor. "You must be the new civilian nurse," Patricia Wong said, her tone neither welcoming nor hostile, simply matter of fact. "Sarah Mitchell, correct? I'm Patty Wong, senior nurse in this department. You'll be working under my supervision until you prove you can handle our protocols." There was something in her voice that suggested proving oneself here would be significantly more challenging than in other medical facilities. Sarah nodded respectfully, extending her hand in greeting. "Yes, ma'am. I'm looking forward to learning from everyone here and contributing to the team." Her voice was steady, but inside she felt a flutter of nervousness. The way Nurse Wong examined her, from her civilian clothing to her unmarked nursing bag, made Sarah acutely aware that she was being evaluated before she'd even begun. Civilian hospitals and military facilities operate very differently, Patty continued, returning to her clipboard but keeping one eye on Sarah. "Here, we follow chain of command, we respect protocol, and we don't question orders from our superiors. Medical decisions are made by those with rank and experience, not by new graduates who think they know better." The message was clear. Stay in your lane and don't overstep boundaries. Before Sarah could respond, the unmistakable sound of military boots echoed through the department. The rhythm was sharp and precise, each step announcing the arrival of someone accustomed to commanding respect. Conversations quieted, postures straightened, and even the most senior nurses seemed to shift into a more formal stance. Sarah turned to see a tall man in his mid-40s approaching, his white coat pristine and his bearing unmistakably military despite the medical setting. Dr. Colonel James Hartford was exactly what Sarah had imagined when she thought of military physicians. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. His dark hair was perfectly groomed, his jaw set in a permanent expression of authority, and his pale blue eyes seemed to catalog every detail of his surroundings with tactical precision. The insignia on his collar and the way other staff members deferred to him made it clear that he wasn't just a doctor here. He was the commanding presence that shaped the entire department's culture. "Wong," he said curtly, acknowledging the senior nurse with a brief nod before his gaze settled on Sarah. His expression shifted almost imperceptibly, the kind of subtle change that suggested immediate judgment had been rendered. "And you must be our new civilian addition. I trust Wong has explained how things work here?" Sarah felt the weight of his scrutiny and fought the urge to fidget under his intense stare. "Yes, sir. I'm Sarah Mitchell, and I'm eager to contribute to the excellent care this facility provides." She kept her voice professional and respectful, though something in his demeanor triggered a defensive instinct she had to consciously suppress. "Doctor." Hartford's lips curved into what might have been mistaken for a smile, if not for the coldness that remained in his eyes. "Eager? Yes, I'm sure you are. Tell me, Miss Mitchell, what makes you think a civilian nurse can adapt to the rigorous standards we maintain here? This isn't some community hospital where protocols are suggestions and medical decisions are made by committee." The question hung in the air like a challenge, and Sarah was acutely aware that everyone within earshot was listening to her response. She could feel the eyes of other nurses, residents, and medical staff focused on this moment, perhaps wondering if the new civilian would wilt under the colonel's intimidating presence or find some way to hold her ground. "I believe excellent patient care transcends the distinction between civilian and military environments," Sarah replied carefully. "While I respect that protocols here may be different, my commitment to learning and following proper procedures remains constant. I'm here to serve the patients and support the medical team in whatever capacity is needed." Dr. Hartford's expression didn't change, but something flickered in his eyes that suggested her response had been noted and filed away for future reference. "Idealistic," he said, the word carrying just enough condescension to sting without being overtly hostile. "We'll see how your idealism holds up when real pressure situations arise. This isn't nursing school, Miss Mitchell. Lives depend on instant decision-making and flawless execution." With that pronouncement, he turned his attention back to Nurse Wong, dismissing Sarah as effectively as if she'd suddenly become invisible. "I want the new civilian observed closely. Any mistakes, any deviations from protocol, any sign that she can't handle our standards, and I want to know about it immediately. We can't afford weak links in this department." The morning continued, with Sarah being oriented to the various systems, procedures, and expectations that governed Fort Mason's emergency department. Every computer system required different login credentials, every medication cabinet had specific protocols for access, and every piece of equipment came with detailed operating procedures that differed subtly but significantly from civilian hospitals. Sarah absorbed the information methodically, taking notes in a small notebook and asking clarifying questions when necessary. What struck her most was the underlying tension that seemed to permeate every interaction. Military hospitals, she realized, existed in a constant state of readiness. At any moment, they might receive casualties from training exercises, combat deployments, or emergency situations that required immediate mobilization of resources. This perpetual state of preparedness created an atmosphere where efficiency wasn't just valued, it was essential for survival. During her lunch break, Sarah sat alone in the hospital cafeteria, reviewing her notes and trying to process everything she'd absorbed during her first morning. The cafeteria itself reflected the military culture, with tables arranged in neat rows, nutritional information posted prominently, and a serving system that moved with clockwork precision. She watched as different groups of staff members ate together, noticing how civilian employees tended to cluster separately from military personnel, creating an unspoken but visible social hierarchy. "Mind if I sit here?" The voice belonged to a young man in military fatigues, his name tape reading Rodriguez. He appeared to be in his early 20s, with kind eyes and a genuine smile that seemed at odds with the serious atmosphere she'd encountered elsewhere in the hospital. "Please," Sarah said, grateful for any friendly interaction after the morning's intensity. "I'm Sarah, the new nurse in emergency." "Danny Rodriguez, combat medic," he replied, settling into the chair across from her. "I heard Hartford gave you the full treatment this morning. Don't take it personally, he does that to everyone new, especially civilians. It's like his way of testing whether people will break under pressure." Sarah appreciated his attempt at reassurance, though she suspected there was more to Dr. Hartford's hostility than simple testing. "Is it always so intense here? I mean, I expected military hospitals to be different, but the atmosphere feels almost combative." Danny laughed, but there was understanding in his expression. "You're not wrong. This place operates like we're always one emergency away from being overwhelmed. Hartford runs the emergency department like a military operation because, in his mind, that's exactly what it is. He's seen combat, served in Afghanistan, Iraq, places where split-second decisions meant the difference between soldiers coming home or not. I think he brings that intensity to everything he does here." "That makes sense," Sarah said thoughtfully. "I can respect that kind of dedication, even if the delivery is intimidating. I just want to prove that I can contribute meaningfully to the team." "You will," Danny said with conviction. "Most of the staff here are good people. They're just protective of their environment. Military medicine is different, not better or worse than civilian medicine, just different. Once you understand the culture and prove you can handle the pressure, things will get easier." As they talked, Sarah began to understand that her challenge wasn't just about demonstrating medical competence. She needed to prove that she could thrive in a culture built on hierarchy, precision, and unwavering commitment to mission success. The nursing skills she'd mastered in school would only take her so far. Adapting to the military mindset would require something deeper. The afternoon brought Sarah's first real exposure to the emergency department's patient flow. Unlike civilian hospitals, where cases might range from minor injuries to serious emergencies, Fort Mason dealt primarily with military personnel and their families. This meant treating everything from routine medical issues to complex trauma, cases involving service members who had been injured during training exercises or were dealing with ongoing complications from previous deployments. Sarah was assigned to shadow Nurse Wong for her first few patient interactions, observing how protocols were implemented and learning the specific documentation requirements that governed military medical records. Every entry had to be precise, every medication administration documented with military attention to detail, and every communication with patients followed established guidelines that balanced medical care with respect for military culture. Her first patient was a young sergeant who had sustained a minor laceration during a training exercise. As Sarah watched Nurse Wong clean and dress the wound, she noticed how the interaction differed from civilian patient care. There was mutual respect between the nurse and patient, acknowledgement of shared understanding about military service, and communication that incorporated military terminology naturally. The sergeant didn't question treatment recommendations or demand extensive explanations. There was an inherent trust in the medical team's expertise that Sarah found both impressive and somewhat foreign. The second case was more complex, involving a military spouse experiencing complications from a chronic condition. Here, Sarah observed how the team balanced medical care with sensitivity to the unique stresses faced by military families. The patient was dealing not only with her health issues, but also with the anxiety of her husband's upcoming deployment. Nurse Wong's approach incorporated both clinical expertise and emotional support, demonstrating that military medicine required the same compassion as civilian care, just expressed within a different cultural framework. As the day progressed, Sarah began to feel more comfortable with the rhythm and expectations of the department. She assisted with patient care under supervision, learned to navigate the computer systems efficiently, and started building rapport with some of the other staff members. Not everyone was as welcoming as Danny Rodriguez, but most seemed willing to give her a chance to prove herself. Dr. Hartford remained a constant presence throughout the afternoon, making rounds, reviewing cases, and maintaining the high standards that clearly defined his leadership style. Sarah noticed that while his demeanor was consistently serious and demanding, his medical knowledge was exceptional and his dedication to patient care absolute. Other staff members respected him, even if they seemed somewhat intimidated by his intensity. Late in the afternoon, as Sarah was updating patient charts under Nurse Wong's supervision, she overheard a conversation between two residents discussing Dr. Hartford's background. Apparently, he had served multiple combat deployments as a military physician, treating wounded soldiers under conditions that most medical professionals would find unimaginable. His decorations included medals for valor and medical service, and his reputation extended far beyond Fort Mason to military medical facilities worldwide. This information gave Sarah new perspective on the morning's interactions. Dr. Hartford's intensity wasn't personal antagonism. It was the result of experiences where medical mistakes had life and death consequences that extended beyond individual patients to military missions and national security. Understanding this didn't make his behavior less challenging to deal with, but it helped her appreciate the standards he was trying to maintain. As her first day at Fort Mason drew to a close, Sarah felt a mixture of exhaustion, accomplishment, and determination. The learning curve was steep, the expectations demanding, and the cultural adjustment more significant than she had anticipated. But she also felt energized by the challenge and more convinced than ever that this was where she was meant to be. Walking back through the hospital corridors toward the exit, Sarah passed the memorial wall again, spending a few moments reading the citations and looking at the photographs of distinguished service members. Their faces told stories of sacrifice, courage, and commitment that put her own challenges into perspective. These were people who had risked everything in service to others, and now she had the privilege of caring for members of that same community. Outside, the Colorado evening air was cool and refreshing after the intensity of the hospital environment. Sarah stood for a moment, looking back at the building that would become her professional home, feeling both daunted and inspired by what lay ahead. Tomorrow would bring new challenges, new opportunities to prove herself, and new chances to demonstrate that her commitment to nursing excellence could thrive in any environment. As she walked to her car, Sarah's thoughts turned to her father and the conversation they'd had when she first announced her intention to work at a military hospital. He had been supportive but curious about her motivations, wondering why she would choose such a challenging environment when she had other options available. At the time, Sarah hadn't been able to articulate her reasons clearly, speaking vaguely about service and challenge. Now, after just one day at Fort Mason, she was beginning to understand her own motivations more clearly. This wasn't about proving anything to anyone else. It was about discovering what she was truly capable of when pushed beyond her comfort zone. Military medicine would demand everything she had to give, and then some. But in return, it would help her become the kind of nurse she had always dreamed of being: competent, confident, and completely committed to excellence in patient care. The drive home gave Sarah time to reflect on the day's experiences and prepare mentally for what was to come. She knew that Dr. Hartford would continue to test her, that fitting into the department's culture would require ongoing effort, and that every day would bring new challenges to overcome. But she also knew that she was exactly where she belonged, even if proving it would require every ounce of strength, skill, and determination she possessed. The second week at Fort Mason brought new challenges that tested every aspect of Sarah's nursing education and personal resilience. Dr. Colonel Hartford seemed to have made it his personal mission to scrutinize her every move, appearing at the most inconvenient moments to question her decisions or critique her techniques. It wasn't unusual for Sarah to be in the middle of administering medication when his authoritative voice would cut through the ambient noise of the emergency department, asking pointed questions about dosages, contraindications, or protocol variations that she might not have considered. During one particularly busy Tuesday morning, Sarah was caring for a young airman who had suffered burns during a routine maintenance operation. The injuries weren't life-threatening, but they required careful cleaning and dressing to prevent infection. Sarah had reviewed the case thoroughly, consulted the appropriate protocols, and was methodically working through the treatment process. When Dr. Hartford materialized beside her, his presence immediately shifting the atmosphere in the trauma bay. "Miss Mitchell," he said, his voice carrying that familiar tone of skeptical authority. "What's your rationale for using silver sulfadiazine on these burns rather than the newer antimicrobial agents we have available?" The question wasn't inherently hostile, but the way he asked it, with other staff members within earshot, created an impromptu examination that put Sarah on the spot. Sarah paused in her work, keeping her hands steady as she continued to clean the wound while formulating her response. She had chosen the treatment based on her assessment of the burn depth and her knowledge of the patient's medical history. But now, she had to justify that decision to someone whose medical experience far exceeded her own. "The burns are primarily second degree with minimal depth variation," she explained, her voice remaining calm despite the pressure she felt. "Silver sulfadiazine provides effective antimicrobial coverage while maintaining good penetration characteristics for this type of injury. The patient has no documented allergies to sulfa medications, and his renal function is normal, so there are no contraindications." Dr. Hartford stepped closer, examining her work with the intensity of someone conducting a formal evaluation. "And you've considered the potential for delayed healing with silver-based treatments? Have you reviewed current literature on antimicrobial efficacy in military populations?" Each question felt like another layer of challenge, designed to probe the depth of her knowledge and expose any gaps in her understanding. "I have, Sarah replied, continuing her work without allowing his scrutiny to affect her technique. The literature suggests that while newer agents may offer some advantages in specific circumstances, silver sulfadiazine remains highly effective for burns of this classification, particularly when cost-effectiveness and proven outcomes are considered. Military protocols still listed as first-line treatment for this type of injury. The airman on the stretcher watched this exchange with growing concern, clearly uncomfortable with being the subject of what appeared to be a professional disagreement. Sarah noticed his anxiety and made a conscious effort to include him in the conversation. "We're discussing the best treatment options for your burns," she explained to him directly. "Both approaches we're considering are excellent choices, and we want to make sure we're giving you the most appropriate care for your specific situation." Dr. Hartford's expression remained unreadable, but Sarah caught a flicker of something that might have been approval for her patient communication skills. "Adequate reasoning," he said finally, though his tone suggested this was hardly high praise. "Continue with your current approach, but I want documentation of your rationale in the patient record, and I want to see follow-up assessments at 8-hour intervals for the next 24 hours. As he moved away to attend to other cases, Sarah felt the familiar mixture of relief and frustration that followed most of her interactions with the colonel. She understood that his challenges were meant to ensure competency and maintain standards. But the constant scrutiny was wearing on her confidence and making every decision feel like a potential misstep. Other nurses in the department had noticed the pattern, and while some seemed sympathetic to her situation, others appeared to view Dr. Hartford's attention as confirmation that Sarah didn't quite belong in their environment. Nurse Wong had become slightly more approachable as the days passed, but her feedback remained consistently focused on areas for improvement rather than acknowledgement of progress. During their weekly evaluation meeting, she sat across from Sarah, in the small conference room adjacent to the emergency department, her clipboard filled with detailed observations and assessments. "Your clinical skills are developing appropriately," Wong began, her tone professional but not encouraging. "However, there are concerns about your integration into the department culture. Military medicine requires absolute confidence in team dynamics, and some staff members have expressed uncertainty about your ability to function effectively under pressure." Sarah felt a knot forming in her stomach as she listened to this assessment. She had worked diligently to learn protocols, had asked for feedback when uncertain, and had tried to build relationships with her colleagues. Hearing that her efforts were being interpreted as signs of weakness or inadequacy was disheartening, especially when she felt like she was making genuine progress. "Could you be more specific about the concerns?" Sarah asked, trying to keep defensiveness out of her voice. "I want to address any issues and improve my performance, but I need to understand exactly what behaviors or decisions are causing problems." Wong consulted her notes, her expression remaining neutral. "Dr. Hartford has noted that you tend to seek confirmation for decisions that experienced nurses would make independently. While thoroughness is generally positive, in emergency situations, hesitation can be interpreted as lack of confidence or competence. Additionally, some staff members feel that you ask too many questions about procedures that should be routine by now." The feedback stung because Sarah recognized there was truth in it, even if the interpretation felt unfair. She had been seeking confirmation because she wanted to ensure she was following military protocols correctly, not because she lacked confidence in her nursing abilities. The questions she asked were motivated by thoroughness rather than incompetence. But she was beginning to understand that perception mattered as much as reality in this environment. "I appreciate the feedback," Sarah said carefully. "I've been asking questions because I want to make sure I'm adapting properly to military protocols, not because I'm uncertain about fundamental nursing principles. Moving forward, I'll work on demonstrating more independence while still ensuring I'm following appropriate procedures." Wong made additional notes on her clipboard. "That would be advisable. Military medicine requires personnel who can function autonomously while still respecting chain of command. Finding that balance is essential for success here." She looked up from her notes, and for the first time, Sarah detected a hint of something that might have been encouragement in her expression. "Your knowledge base is solid, Mitchell. The challenge is learning to apply it confidently within our specific culture." The conversation left Sarah with mixed feelings as she returned to her duties. On one hand, she was frustrated by the narrow margin for error and the way her careful approach was being interpreted as weakness. On the other hand, she was beginning to understand the expectations more clearly and felt capable of adjusting her behavior to meet them. Military medicine wasn't just about clinical competence. It was about projecting confidence, making decisive choices, and functioning seamlessly within a hierarchical structure that valued efficiency above all else. Later that afternoon, Sarah found herself working alongside Dr. Maria Santos, one of the emergency medicine residents who had been generally neutral in her interactions but seemed more approachable than some of the other physicians. They were treating a military dependent, a teenager whose mother was deployed overseas and whose father was struggling to manage both his military duties and single parenting responsibilities. The case itself wasn't particularly complex medically, but it required sensitivity to the unique stressors facing military families. The teenager had been experiencing recurring headaches and fatigue, symptoms that could indicate anything from stress-related tension to more serious underlying conditions. As they worked through the diagnostic process, Dr. Santos began explaining her thought process in a way that felt more like collaboration than evaluation. Military families face stressors that civilian families rarely encounter, Santos explained as they reviewed the patient's history. Deployment separations, frequent relocations, uncertainty about future assignments. These factors can manifest in physical symptoms that require careful assessment. We need to rule out organic causes while also addressing the psychological components. Sarah appreciated both the medical education and the insight into military family dynamics. "How do you balance addressing those stressors with maintaining appropriate boundaries?" she asked. "In civilian settings, we might recommend family, counseling, or support groups, but I'm not sure how those resources work in military communities." "Good question," Santos replied, seeming genuinely pleased by Sarah's interest. "Military families have access to specific support systems through family readiness groups, chaplain services, and military family life counselors. Understanding these resources is part of providing comprehensive care in this environment. It's not enough to treat the medical symptoms. We need to connect families with appropriate support systems." As they continued working with the patient, Sarah felt like she was gaining valuable insights not just into military medicine, but into the broader culture she was trying to navigate. Dr. Santos represented a different model of leadership than Dr. Hartford, one that emphasized mentorship and collaboration rather than challenge and evaluation. Both approaches had their place, Sarah realized, but working with Santos reminded her why she had been drawn to nursing in the first place. The teenager they were treating gradually opened up about his struggles with his mother's deployment and his worry about his father's stress levels. Sarah found herself drawing on communication skills she had developed during her training, listening actively and providing reassurance while gathering the information necessary for proper diagnosis and treatment. When Dr. Santos complimented her patient interaction skills, Sarah felt a surge of confidence that had been missing during her recent interactions with Dr. Hartford. As the week continued, Sarah began to notice patterns in the department's operations that helped her understand the underlying tensions she had been experiencing. Military medicine operated under constant pressure to maintain readiness for mass casualty events, deployment medicine, and combat support operations. This pressure created an environment where mistakes weren't just individual failures. They were potential weaknesses in a system designed to support national security objectives. Dr. Hartford's intensity, she realized, wasn't personal antagonism, but rather the manifestation of someone who had experienced firsthand what happened when medical systems failed under pressure. His challenges weren't meant to humiliate her. They were designed to test whether she could function effectively when lives depended on split-second decision-making and flawless execution. Understanding this didn't make his approach any less intimidating, but it helped Sarah appreciate the seriousness of the standards she was expected to meet. During a particularly quiet evening shift, Sarah found herself working alongside Corporal Rodriguez again, and their conversation turned to the challenges of adapting to military medical culture. Danny had been stationed at Fort Mason for 2 years and had observed many civilian medical professionals struggle with the adjustment process. "The thing about military medicine," he explained as they restocked supplies, "is that everything we do here is connected to something bigger. When we treat a soldier, we're not just healing an individual, we're maintaining military readiness. When we train new personnel, we're not just developing careers, we're ensuring mission capability." Hartford gets that connection in a way that's hard to explain to people who haven't experienced combat medicine. Sarah found this perspective helpful in understanding why her adaptation process felt so intense. "How long does it typically take for civilian medical staff to feel fully integrated?" she asked, hoping for some reassurance about her timeline for acceptance. "Varies," Danny replied honestly. "Some people adapt quickly and some never really fit. The ones who succeed usually have something that connects them to military culture, maybe family background or personal experiences that help them understand the mindset. The ones who struggle tend to be those who can't appreciate why everything here is so serious and demanding." As Danny spoke, Sarah felt a familiar pang when he mentioned family background as a connecting factor. Her father's military service was certainly relevant, but she had deliberately chosen not to mention it when she started at Fort Mason. She wanted to succeed based on her own merits rather than benefiting from any perceived connection to military culture. Now she was beginning to wonder if that decision had been wise, particularly given how much she was struggling to gain acceptance from her colleagues. The conversation was interrupted by the arrival of an ambulance carrying a soldier who had been injured during a training exercise. The injury wasn't immediately life-threatening, but it required prompt attention and careful assessment to prevent complications. Sarah joined the response team, working efficiently to assist with the initial evaluation and treatment process. As they worked, Sarah noticed how seamlessly the military and civilian staff functioned together when focused on patient care. These saw hierarchies and cultural tensions that seemed so prominent during routine operations faded into the background when medical expertise became the primary concern. Dr. Hartford directed the team with calm authority, his experience evident in every decision and instruction. Nurse Wong coordinated care with military precision, and even the newest residents contributed effectively to the overall effort. Sarah found herself functioning confidently within this dynamic, her nursing skills integrating naturally with the team's approach. She anticipated needs, provided assistance without being asked, and communicated clearly with both medical staff and the patient. For the first time since arriving at Fort Mason, she felt like she was truly contributing to the team rather than simply trying to avoid making mistakes. When the case was resolved and the patient stabilized, Dr. Hartford approached Sarah with an expression that seemed less critical than usual. "Adequate performance, Mitchell," he said. And while the praise was minimal, Sarah detected a slight softening in his tone. "Continue developing that level of efficiency, and you might eventually function acceptably in this environment." The backhanded compliment was probably the most positive feedback Sarah had received from Dr. Hartford since her arrival, and she found herself feeling genuinely encouraged by the interaction. Perhaps her persistence was beginning to pay off, and perhaps her colleagues were starting to see her as something more than just another civilian nurse who didn't understand military culture. As her third week at Fort Mason began, Sarah felt like she was finally starting to find her rhythm within the department's demanding environment. Her clinical skills were solid, her understanding of military protocols was improving, and her confidence was gradually returning. The constant scrutiny from Dr. Hartford remained challenging, but she was learning to view it as professional development rather than personal attack. The department's morning briefing had become a routine that Sarah actually looked forward to, despite the formal military structure that governed these meetings. Dr. Hartford would review the previous day's cases, discuss any protocol updates or policy changes, and outline the day's priorities and staffing assignments. These briefings provided valuable insights into the broader operations of military medicine and helped Sarah understand how individual cases fit into larger patterns of care and readiness. During one particularly comprehensive briefing, Dr. Hartford discussed the hospital's role in supporting upcoming military exercises that would involve multiple units and potentially result in various types of injuries. The emergency department needed to be prepared for everything from minor trauma to complex multi-system injuries, and all staff members were expected to review appropriate protocols and ensure their skills were current. Military exercises are designed to simulate combat conditions as realistically as possible, Hartford explained to the assembled staff. This means we can expect to see injury patterns that civilian hospitals rarely encounter. Blast injuries, combat-related trauma, environmental injuries from extreme conditions. These cases require specialized knowledge and immediate, decisive treatment. Sarah listened intently, recognizing that this was exactly the kind of situation where her civilian background might be seen as a liability rather than an asset. She had studied trauma care extensively during her education, but military-specific injuries involved considerations and treatment approaches that weren't covered in standard nursing curricula. She made mental notes about additional reading and preparation she needed to undertake to ensure she could contribute effectively during these exercises. The briefing also covered staffing adjustments that would be necessary to accommodate the increased patient load during exercise periods. Sarah was surprised to learn that she was being included in the core team responsible for initial trauma assessment, a responsibility that suggested her colleagues were beginning to trust her clinical judgment despite ongoing concerns about her cultural adaptation. After the briefing, Nurse Wong approached Sarah with what appeared to be a mixture of professional obligation and genuine concern. "Mitchell, you're scheduled for trauma response during next week's exercises. Are you confident in your ability to handle military-specific injuries?" The question was fair, and Sarah appreciated Wong's directness. "I've been reviewing military trauma protocols and studying case presentations from combat medicine. I feel prepared for standard trauma cases, but I'd appreciate any additional resources or training opportunities you'd recommend for military-specific situations." Wong nodded approvingly at Sarah's response. "There's a combat medicine simulation session this afternoon. It's primarily designed for military medical personnel, but civilian staff are welcome to participate. I'd recommend attending if you're serious about developing competency in this area." The simulation session turned out to be one of the most intense training experiences Sarah had ever encountered. The scenarios were designed to replicate combat medical situations with realistic injuries, time pressures, and resource limitations that challenged every aspect of medical training. Sarah found herself working alongside military medics, doctors, and nurses in situations that demanded immediate decision-making and flawless execution. One scenario involved multiple casualties from an improvised explosive device, requiring rapid triage and simultaneous treatment of various injury types. Sarah was assigned to work with a team treating a simulated patient with blast-related injuries, complex trauma that required knowledge of pressure wave effects, secondary fragment injuries, and the multi-system complications that could result from explosive mechanisms. As the simulation progressed, Sarah found herself functioning effectively within the team, despite the intensity and unfamiliarity of the scenarios. Her fundamental nursing skills translated well to military medicine, and her ability to remain calm under pressure served her well in the high-stress environment. When Dr. Hartford appeared to observe the simulation, Sarah was too focused on patient care to worry about his evaluation, a mental shift that allowed her to perform at her highest level. The debriefing session after the simulation provided valuable feedback and learning opportunities. Military medical instructors reviewed each team's performance, discussing decision-making processes, protocol adherence, and areas for improvement. When Sarah's team was evaluated, the feedback was generally positive, with particular recognition for their communication and coordination under pressure. Dr. Hartford's comment during the debriefing was characteristically brief, but notably less critical than his usual assessments. Mitchell demonstrated adequate adaptation to military trauma protocols. Continued development in this area should improve overall competency. Coming from him, this qualified as significant praise, and Sarah felt a surge of satisfaction at having met his demanding standards in at least one area. The simulation experience marked a turning point in Sarah's integration into the Fort Mason team. Her performance during the exercises had demonstrated that her clinical skills could indeed translate effectively to military medicine, and her colleagues began to view her with increased respect and confidence. The constant scrutiny didn't disappear entirely, but it evolved from skeptical evaluation to professional mentorship as staff members recognized her commitment to excellence and adaptation. As the week continued, Sarah noticed subtle changes in her interactions with department personnel. Conversations became more collegial, feedback more constructive, and opportunities for independent decision-making more frequent. She was beginning to feel like a legitimate member of the team, rather than an outsider trying to prove her worthiness of inclusion. The upcoming military exercises would provide the ultimate test of her integration and competency. Sarah spent her off-duty hours reviewing protocols, studying case presentations, and mentally preparing for the challenges that lay ahead. She knew that her performance during these exercises would largely determine her long-term success at Fort Mason, and she was determined to demonstrate that civilian nurses could indeed excel in military medical environments when given the opportunity to prove themselves. The piercing wail of multiple sirens shattered the relative calm of Thursday afternoon at Fort Mason Medical Center. Sarah was in the middle of updating patient charts when the emergency alert system activated, its distinctive tone immediately transforming the atmosphere throughout the hospital. Within seconds, the measured pace of routine medical care shifted into the controlled urgency that defined crisis response in military facilities. Mass casualty event. All emergency personnel to trauma stations immediately. The announcement echoed through the corridors, followed by specific instructions about the nature of the incoming casualties. Multiple injuries from training exercise incident at Range 7. Estimated 12 wounded, severity levels unknown. ETA 15 minutes for first ambulance. Sarah's heart rate accelerated as she absorbed the information, but her training kicked in automatically. She secured the chart she had been working on and moved quickly toward her assigned trauma station, joining the stream of medical personnel converging on the emergency department. The transformation was remarkable to witness. Within moments, the entire facility had shifted from routine operations to full crisis mode, with every staff member moving with purpose and precision. Dr. Hartford appeared at the center of the emergency department, his commanding presence even more pronounced as he coordinated the response effort. His voice carried across the space with absolute authority as he issued assignments and ensured all protocols were being followed. Santos, take Trauma Bay 1 with Wong supporting. Rodriguez and Mitchell, Trauma Bay 3. Thompson, coordinate with incoming ambulances for initial triage. Everyone else, standard mass casualty positions. Sarah felt a surge of adrenaline, mixed with apprehension as she realized she was being assigned to a primary trauma bay rather than a supporting role. This represented both an opportunity to demonstrate her capabilities and a significant test of everything she had learned during her time at Fort Mason. As she moved toward Trauma Bay 3, she caught Corporal Rodriguez's eye and saw a mixture of confidence and concern in his expression. "You ready for this?" Danny asked as they quickly reviewed the equipment and supplies in their assigned area. His question was practical rather than doubtful, focused on ensuring they were both prepared for whatever injuries they might encounter. "As ready as I can be," Sarah replied, her voice steady despite the nervous energy coursing through her system. She had trained for situations like this throughout her nursing education and had participated in the recent combat simulation exercises, but facing real casualties with unknown injuries felt entirely different from any preparation she had experienced. The first ambulance arrived exactly on schedule, its red lights reflecting off the hospital windows as it pulled up to the emergency entrance. Through the glass doors, Sarah could see paramedics working frantically over a stretcher, their movements indicating they were dealing with serious injuries. The automatic doors burst open, and the first casualty was wheeled rapidly into the emergency department. 22-year-old male, blast injury from explosive ordnance malfunction, the lead paramedic called out as they transferred the patient to Trauma Bay 1. Multiple fragment wounds, possible internal injuries, vitals, unstable and declining. The information was delivered with the clinical precision that characterized emergency medical communications, but Sarah could hear the underlying urgency in the paramedic's voice. Before she could fully process the first case, the second ambulance arrived, followed closely by a third. The emergency department filled with the controlled chaos of multiple medical teams working simultaneously on different patients, each case requiring immediate assessment and potentially life-saving interventions. Sarah positioned herself at Trauma Bay 3, ready to receive whatever patient was assigned to their team. "Incoming to Bay 3, Dr. Hartford announced, his voice cutting through the ambient noise. Female, approximately 19, training accident victim with suspected spinal injuries and possible internal trauma. Handle with extreme care during transfer." Sarah's pulse quickened as she prepared for the incoming patient, reviewing spinal, immobilization protocols and potential complications associated with training-related injuries. When the stretcher arrived at their bay, she was struck by how young the injured soldier appeared. The woman was conscious but clearly in significant pain, her military uniform torn and stained with blood from various wounds. "What's your name?" Sarah asked gently as she began her initial assessment, establishing rapport while gathering essential information. Her voice was calm and reassuring, designed to provide comfort while maintaining professional efficiency. "Private Jessica Chen," the patient replied, her voice strained but coherent. "I can't feel my legs properly and everything hurts. Is it bad? Am I going to be okay?" The fear in her voice was palpable, and Sarah could see the terror in her eyes as she tried to understand the severity of her injuries. "We're going to take excellent care of you, Private Chen," Sarah responded, beginning her systematic assessment while maintaining eye contact to provide reassurance. "Can you tell me exactly what happened during the training exercise?" As Private Chen described the accident, Sarah worked methodically through her evaluation process, checking vital signs, assessing neurological responses, and documenting her findings for the medical team. The patient had been involved in a vehicle rollover during a combat simulation exercise, resulting in potential spinal compression and multiple trauma injuries that required careful evaluation to prevent further damage. Dr. Hartford appeared at the trauma bay, his presence immediately shifting the dynamic as he took charge of the case assessment. Sarah continued her work while listening to his rapid-fire questions and instructions, grateful for his expertise while trying to demonstrate her own competence in supporting the treatment process. "What's your assessment, Mitchell?" Dr. Hartford asked, his tone indicating this was both a genuine request for information and a test of her clinical judgment. "What are your primary concerns with this patient?" Sarah took a deep breath, organizing her thoughts before responding. Primary concerns are potential spinal cord injury, given the mechanism of injury and her reported numbness. Secondary concerns include possible internal bleeding from abdominal trauma and multiple lacerations that need evaluation for depth and contamination. Vital signs are currently stable, but require close monitoring for signs of shock or deterioration. Dr. Hartford nodded curtly, his expression suggesting her assessment was adequate if not exceptional. Correct priorities: initiate spinal precautions, establish IV access, and prepare for imaging studies. Rodriguez, coordinate with radiology for immediate CT scans of cervical spine and abdomen. As the team worked together to stabilize Private Chen and prepare her for diagnostic studies, Sarah found herself functioning smoothly within the established protocols while adapting to the specific requirements of military trauma care. The intensity of the situation demanded absolute focus, but she discovered that her training and recent experience had prepared her well for this level of pressure and responsibility. The next several hours became a blur of continuous patient care as additional casualties arrived from the training exercise incident. Sarah rotated between different cases, providing support wherever needed while maintaining primary responsibility for Private Chen's ongoing care. Each patient presented unique challenges that tested different aspects of her medical knowledge and clinical skills. One case involved a soldier with severe burns from an equipment malfunction, requiring specialized treatment protocols that Sarah had studied but never implemented in practice. Another patient suffered from what appeared to be a traumatic brain injury, necessitating careful neurological monitoring and immediate consultation with specialists. The variety and complexity of injuries demonstrated why military medical facilities required such rigorous training and preparation. Throughout the crisis response, Sarah noticed how seamlessly the entire medical team functioned despite the chaos and pressure surrounding them. Dr. Hartford moved between trauma bays with calm authority, making critical decisions and providing guidance without disrupting the flow of care. Nurse Wong coordinated resources and personnel with military precision, ensuring that supplies and equipment were available when needed. Even the newest residents and medics contributed effectively to the overall effort. What struck Sarah most profoundly was how her colleagues' perception of her seemed to shift during the crisis. The cultural tensions and hierarchical concerns that had dominated her early weeks at Fort Mason faded into irrelevance when medical expertise became the primary consideration. She was no longer the civilian nurse trying to prove her worthiness. She was simply a medical professional contributing her skills to save lives and provide excellent patient care. Dr. Hartford's interactions with her during the crisis were notably different from their previous encounters. His questions were focused on clinical judgment rather than cultural adaptation, and his feedback was constructive rather than critical. When he complimented her patient communication skills while working with Private Chen, Sarah realized that he was beginning to see her as a competent colleague rather than a liability to be managed. As the immediate crisis phase concluded and patients were stabilized for transfer to appropriate specialty units, Sarah felt a profound sense of accomplishment mixed with exhaustion. She had successfully managed multiple complex cases, contributed meaningfully to the team effort, and demonstrated that her skills could indeed translate effectively to military medical environments under the most demanding circumstances. The debriefing session that followed the mass casualty response provided valuable feedback and learning opportunities for all involved personnel. Dr. Hartford led the discussion, reviewing each case systematically and identifying areas where protocols had been followed effectively, as well as opportunities for improvement in future responses. When the evaluation reached Sarah's performance, she held her breath, uncertain what kind of feedback she would receive. Dr. Hartford's assessment was characteristically direct, but notably more positive than his previous evaluations. Mitchell demonstrated appropriate clinical judgment and effective patient care under pressure. Her communication skills with patients were particularly noteworthy, and her ability to function within the team structure showed significant improvement. The positive feedback felt like a major milestone in Sarah's integration into the Fort Mason team. For the first time since her arrival, she felt genuinely accepted as a legitimate member of the medical staff, rather than an outsider trying to prove her worth. The crisis had provided an opportunity to demonstrate her capabilities in the most authentic way possible, and her colleagues had responded with increased respect and confidence. Later that evening, as Sarah completed her documentation and prepared to end her shift, she reflected on how much had changed during the course of a single day. The mass casualty event had been challenging and exhausting, but it had also been deeply rewarding in ways she hadn't anticipated. She had discovered that her nursing skills were indeed sufficient for military medicine when applied with confidence and precision. Corporal Rodriguez approached her as she gathered her belongings, his expression reflecting the satisfaction that comes from successfully managing a difficult situation. "You did great today, Sarah. I've been through a lot of these mass casualty events, and you handled everything like you'd been doing military medicine for years." The compliment meant more to Sarah than Danny probably realized. Coming from someone with extensive experience in military medical situations, his praise felt like genuine recognition of her competence rather than polite encouragement. She was beginning to understand that earning respect in military medicine required demonstrating capability under the most demanding circumstances, and today had provided exactly that opportunity. Dr. Hartford appeared as Sarah was leaving the department, his presence no longer as intimidating as it had been during her first weeks at Fort Mason. "Mitchell," he said, his tone suggesting he had something specific to communicate. "Your performance today was satisfactory. Continue developing your skills in military trauma protocols, and you may eventually become a valuable asset to this department." Coming from Dr. Hartford, this represented the highest praise Sarah had received since her arrival. She recognized that his standards were exceptionally high and that his approval was not easily earned. The fact that he was beginning to view her as a potentially valuable team member rather than a liability represented a significant shift in their professional relationship. As Sarah drove home that evening, she felt a sense of accomplishment and belonging that had been absent during her early weeks at Fort Mason. The day's events had tested every aspect of her medical training and personal resilience, but she had emerged from the experience with increased confidence and the respect of her colleagues. For the first time, she felt like she truly belonged in the world of military medicine. The next morning brought a return to routine operations, but Sarah noticed that her interactions with other staff members had fundamentally changed. Conversations were more collegial, feedback more constructive, and opportunities for independent decision-making more frequent. The mass casualty event had served as a professional baptism by fire, and she had emerged from the experience as a recognized member of the team. Nurse Wong approached Sarah during the morning briefing with what appeared to be genuine respect, rather than her previous professional courtesy. "Mitchell, your documentation from yesterday's cases was excellent. Comprehensive, accurate, and clinically relevant. That's exactly the standard we expect for military medical records." The positive feedback continued throughout the day as Sarah encountered colleagues who had witnessed her performance during the crisis. Even staff members who had been skeptical about her ability to adapt to military medicine seemed to view her with increased respect and confidence. The cultural barriers that had seemed so insurmountable during her first weeks were beginning to dissolve as her clinical competence became the primary factor in how others evaluated her contribution to the team. Dr. Santos stopped by Sarah's station during a quiet moment to discuss one of the cases from the previous day. Their conversation was notably more collegial than previous interactions, with Santos treating Sarah as a peer rather than a student requiring guidance. "Your assessment of Private Chen's neurological status was particularly thorough," she commented. "That kind of detailed evaluation is crucial for tracking recovery and identifying potential complications." The recognition from Dr. Santos felt especially meaningful because it came from someone whose opinion Sarah respected and whose approach to military medicine emphasized both clinical excellence and compassionate patient care. Knowing that her work met the standards of someone she admired professionally provided additional confirmation that she was successfully adapting to the demands of military medicine. As the week continued, Sarah found herself taking on increasingly complex cases and greater responsibility within the department. Dr. Hartford began consulting with her about treatment decisions rather than simply evaluating her performance, a shift that indicated growing trust in her clinical judgment. The constant scrutiny that had characterized her early weeks was replaced by the kind of professional oversight that applied to all staff members regardless of their background. The transformation in Sarah's professional relationships extended beyond the emergency department to other areas of the hospital where she interacted with different medical specialties and support staff. Word of her performance during the mass casualty event had spread throughout the facility, and she noticed that other personnel treated her with the respect accorded to competent medical professionals, rather than the polite courtesy extended to newcomers still proving themselves. One afternoon, while reviewing cases with Dr. Hartford, Sarah experienced a moment of professional satisfaction that crystallized how much her situation had improved. They were discussing treatment options for a complex trauma case, and Dr. Hartford was genuinely seeking her input rather than testing her knowledge. The conversation felt like a consultation between colleagues who respected each other's expertise, rather than an evaluation of her worthiness to participate in medical decision-making. "Your perspective on pain management protocols has been valuable," Dr. Hartford commented during their discussion. "Military patients often have different pain tolerance levels and medication responses than civilian populations, and your observations about individual variation have been clinically useful." The compliment was delivered in Dr. Hartford's characteristic understated style, but Sarah recognized it as significant praise from someone whose approval was not easily earned. More importantly, she felt that her contributions were being valued for their clinical merit, rather than being evaluated primarily through the lens of her civilian background and cultural adaptation challenges. As Sarah prepared to leave Fort Mason that evening, she realized that something fundamental had shifted in her professional identity. She no longer felt like a civilian nurse trying to prove her worthiness to work in a military environment. She felt like a competent medical professional who happened to work in a military facility. The distinction was subtle but profound, representing a transformation from outsider seeking acceptance to insider contributing expertise. The drive home provided time for Sarah to reflect on her journey from the uncertainty and cultural conflicts of her early weeks to the professional satisfaction and collegial relationships she was now experiencing. The mass casualty event had been the catalyst for this transformation, but she recognized that the foundation had been built through weeks of persistent effort, continuous learning, and unwavering commitment to excellence in patient care. Looking toward the future, Sarah felt optimistic about her long-term prospects at Fort Mason and her developing career in military medicine. The challenges that had seemed overwhelming during her initial adaptation were now manageable aspects of a demanding but rewarding professional environment. She had proven to herself and her colleagues that civilian medical professionals could indeed excel in military settings when they approached the work with appropriate respect, dedication, and willingness to learn. The aftermath of the mass casualty event had settled into a rhythm of recovery and reflection when an unexpected visitor arrived at Fort Mason Medical Center. Sarah was completing her patient rounds, checking on Private Chen's progress and ensuring that all documentation was current, when Nurse Wong approached her with an unusual expression of curiosity mixed with formality. "Mitchell, there's someone here to see you," Wong said, her tone suggesting this wasn't a routine visit from a colleague or family member. "He's waiting in the administrative conference room, and he specifically requested to speak with you about your performance during yesterday's emergency response." Sarah felt a flutter of concern as she tried to imagine who might want to discuss her work and why such a conversation would take place in the administrative area rather than within the emergency department. She had received positive feedback from her immediate supervisors, but the formal nature of this request suggested something more significant than routine performance evaluation. "Do you know who it is, or what this is about?" Sarah asked, trying to keep anxiety out of her voice while mentally reviewing her actions during the crisis to identify any potential issues that might require administrative attention. Wong's expression was unreadable, but there was something in her demeanor that suggested she knew more than she was revealing. He introduced himself as Colonel William Patterson from Fort Carson. "That's all the information I have, but he seemed very interested in getting detailed information about your background and qualifications." The mention of Fort Carson, another major military installation in Colorado, added to Sarah's confusion about the purpose of this unexpected visit. She couldn't think of any reason why someone from outside Fort Mason would be interested in her performance, particularly since she had only been working there for a few weeks and had limited experience with military medicine. As Sarah made her way to the administrative wing, she tried to prepare herself for whatever this meeting might entail. The conference room was located in a section of the hospital she rarely visited, surrounded by offices occupied by senior administrators and military personnel responsible for the facility's overall operations. The formal atmosphere of this area reinforced her sense that whatever was about to happen was more significant than routine workplace communication. Colonel Patterson was a distinguished-looking man in his early 60s, his uniform displaying numerous ribbons and insignia that indicated extensive military service and high-level responsibilities. When Sarah entered the conference room, he stood and extended his hand with a warm smile that immediately put her somewhat at ease despite the formal circumstances. "Miss Mitchell, thank you for taking the time to meet with me," he said, his voice carrying the authority of someone accustomed to command, but tempered with genuine warmth. "I'm Colonel Patterson from Fort Carson, and I wanted to speak with you about your exceptional performance during yesterday's emergency response." Sarah accepted his handshake, still puzzled about why her work would have attracted attention from outside Fort Mason. "Thank you, sir, but I'm not sure I understand why my performance would be of interest to someone from Fort Carson. I simply did my job during a challenging situation." Colonel Patterson gestured for her to sit, then took a seat across from her at the polished conference table. "Your modesty is admirable, but according to the reports I've received, your contributions went well beyond simply doing your job. Dr. Hartford specifically mentioned your clinical judgment, patient care skills, and ability to function effectively under extreme pressure." The mention of Dr. Hartford providing positive feedback to someone outside the facility surprised Sarah, given his typically reserved approach to recognition and praise. She was beginning to understand that this meeting represented something more significant than she had initially realized, though she still couldn't determine what that might be. "Miss Mitchell, I'm here because I'm investigating an incident that occurred during yesterday's training exercise, and your name came up repeatedly as someone who provided exceptional medical care to the casualties," Colonel Patterson continued. "But before we discuss that, I need to ask you some questions about your background and family history." Sarah felt her heart rate increase as the conversation took an unexpected turn toward personal information. She had been careful to keep her family background private since starting at Fort Mason, preferring to be evaluated based on her own merits rather than any connections to military culture through her father's service. "I'm not sure what aspects of my background would be relevant to an incident investigation," Sarah said carefully. "My employment records and qualifications should contain all the professional information that would be pertinent to my work here." Colonel Patterson leaned forward slightly, his expression becoming more serious. "Miss Mitchell, one of the soldiers you treated yesterday, Private Chen, mentioned during her interview that you seemed unusually knowledgeable about military culture and combat-related injuries for someone with a civilian nursing background. She was particularly impressed by your understanding of the psychological aspects of military service and your ability to communicate effectively with military personnel." Sarah realized that her natural familiarity with military terminology and culture, developed through years of living with a career military father, had been more apparent than she had intended. She had tried to downplay this background, but it seemed that her instinctive understanding of military life had emerged naturally during the crisis situation. "My father served in the military," Sarah admitted, recognizing that further evasion would be inappropriate given the formal nature of this investigation. "I grew up in a military family, so I'm familiar with military culture and terminology. But I've tried to succeed here based on my nursing qualifications rather than my family background." Colonel Patterson's expression shifted in a way that suggested Sarah's answer had provided exactly the information he was seeking. "Miss Mitchell, what was your father's name, rank, and unit of service?" The specificity of the question made Sarah uncomfortable, as she sensed that revealing this information would fundamentally change how she was perceived at Fort Mason. She had worked hard to establish her professional identity independently, and she was reluctant to have her achievements attributed to family connections rather than personal competence. "With respect, sir, I don't understand why my father's service record would be relevant to an incident investigation or my performance as a nurse," Sarah said, trying to maintain professional courtesy while protecting her privacy. Colonel Patterson stood and walked to the window, looking out at the mountains in the distance before turning back to face Sarah. "Miss Mitchell, I think there's been a misunderstanding about the purpose of this meeting. I'm not here to investigate a problem. I'm here because your exceptional performance during yesterday's crisis has attracted positive attention at the highest levels of military medical command." Sarah felt a mixture of relief and confusion as she processed this unexpected information. "I appreciate the recognition, but I still don't understand why my family background would be relevant to that kind of positive attention." "Because," Colonel Patterson said, returning to his seat with a more relaxed posture, "the Army is always interested in identifying and recognizing exceptional medical personnel, particularly those with strong connections to military culture. Your combination of clinical excellence and cultural familiarity makes you exactly the kind of professional we value most highly." The conversation was moving in directions Sarah hadn't anticipated, and she was beginning to suspect that this meeting would have implications far beyond simple recognition of her recent performance. Colonel Patterson's interest in her family background seemed too specific and persistent to be casual curiosity. "Miss Mitchell, I'm going to ask you one more time about your father's military service, and I hope you'll trust me enough to provide honest information. This conversation is going to be much more meaningful if we can establish the complete picture of your background and qualifications." Sarah took a deep breath, recognizing that continued evasion would be both futile and potentially counterproductive. "My father is General Robert Mitchell. He served multiple combat deployments in Afghanistan and Iraq, and he was awarded the Medal of Honor for actions during Operation Enduring Freedom." The silence that followed Sarah's revelation was profound. Colonel Patterson's expression transformed from professional curiosity to something approaching awe, and Sarah could see that this information had fundamentally changed the context of their entire conversation. "General Robert Mitchell is your father?" Patterson asked, his voice reflecting genuine surprise mixed with deep respect. "Miss Mitchell, do you have any idea how extraordinary this is? Your father is one of the most decorated and respected military leaders of his generation." Sarah felt a familiar mixture of pride and burden that always accompanied discussions of her father's military achievements. She was enormously proud of his service and sacrifice, but she had always struggled with living up to the expectations that came with being his daughter. "Yes, I'm aware of my father's distinguished service," Sarah said quietly. "But I chose civilian nursing specifically because I wanted to establish my own professional identity rather than following in his footsteps. I've worked hard to succeed based on my own merits." Colonel Patterson leaned back in his chair, his expression thoughtful as he processed the implications of Sarah's family connection. "Miss Mitchell, I think you may have misunderstood something fundamental about military culture. Your father's service doesn't diminish your own achievements. It provides context for understanding why you've been so successful in adapting to military medicine." Before Sarah could respond, the conference room door opened and Dr. Hartford entered, his expression suggesting he had been invited to join this conversation. Sarah felt her anxiety increase as she wondered what role her supervisor would play in whatever was developing from this unexpected meeting. "Colonel Patterson, Dr. Hartford," Sarah said, acknowledging both men while trying to understand the dynamics of this expanding conversation. Dr. Hartford took a seat at the conference table, his usual stern expression replaced by something that looked almost like admiration. "Mitchell, Colonel Patterson has shared some interesting information about your family background. I have to admit, this explains quite a bit about your performance and adaptation to our environment." Sarah felt a sinking sensation as she realized that her carefully maintained professional separation from her family's military legacy was dissolving before her eyes. Dr. Hartford, I hope you understand that I never intended to conceal this information inappropriately. I simply wanted to be evaluated based on my nursing qualifications rather than my family connections. Your desire to succeed independently is admirable, Dr. Hartford replied, his tone more respectful than Sarah had ever heard from him. But now that we understand your background, your exceptional performance during yesterday's crisis makes complete sense. You didn't just learn military medicine quickly. You grew up understanding military culture at the deepest level. Colonel, Patterson cleared his throat, regaining control of the conversation. Miss Mitchell, the reason I'm here is to offer you an opportunity that doesn't come along very often. Based on your performance yesterday and your family background, Military Medical Command is interested in discussing special assignment opportunities that would utilize both your clinical skills and your unique understanding of military culture. Sarah felt her world shifting as she tried to process the implications of what was being offered. She had come to Fort Mason seeking a challenging civilian nursing position, and now she was being presented with opportunities that would fundamentally change the trajectory of her career. What kind of special assignments? Sarah asked, recognizing that she needed more information before she could even begin to evaluate such opportunities. Military medical teams that deploy to support special operations, combat support hospitals in challenging environments, training programs for military medical personnel, Patterson explained. Positions that require not just clinical excellence, but also the kind of cultural understanding and adaptability that you've demonstrated. The offer was both flattering and overwhelming, representing recognition of her capabilities, while also pulling her toward exactly the kind of military career path she had thought she wanted to avoid. Sarah looked between Colonel Patterson and Dr. Hartford, trying to understand how this conversation had evolved so quickly from routine feedback to life-changing career opportunities. This is a lot to process, Sarah said honestly. I appreciate the recognition and the opportunities you're describing, but I need time to consider what this would mean for my career goals and personal plans. Dr. Hartford spoke up, his voice carrying an unusual tone of respect and encouragement. Mitchell, I want you to know that regardless of what you decide about these special opportunities, your position here at Fort Mason is secure. You've proven yourself to be exactly the kind of nurse we value most highly, and we'd be honored to have you continue as part of our team. The transformation in Dr. Hartford's attitude was remarkable, and Sarah realized that learning about her family background had completely changed how he viewed her contributions and potential. While she appreciated the recognition, she also felt somewhat disappointed that this change seemed to depend more on her father's reputation than her own demonstrated capabilities. Colonel Patterson stood, indicating that the formal portion of their meeting was concluding. Miss Mitchell, I don't need an answer today, but I hope you'll seriously consider the opportunities we've discussed. Military medicine needs people with your combination of skills, dedication, and cultural understanding. As the meeting ended and Sarah made her way back to the emergency department, she felt overwhelmed by the rapid transformation of her professional situation. In the span of a single conversation, she had gone from being a civilian nurse trying to prove her worth to being recognized as someone with exceptional potential for military medical service. The news of Sarah's family background spread quickly through Fort Mason, though Sarah noticed that her colleagues' reactions were more complex than simple admiration for her father's distinguished service. Some staff members seemed to view her with increased respect, while others appeared to question whether her recent success had been based on merit or family connections. Nurse Wong approached Sarah during the afternoon shift with an expression that mixed professional respect with personal curiosity. Mitchell, I have to admit that learning about your family background explains quite a bit about your adaptation to our environment. But I want you to know that your performance during the crisis earned my respect before anyone knew about your father's service. The comment was meaningful to Sarah because it acknowledged both her family legacy and her Individual achievements. She appreciated Wang's recognition that her clinical performance had been evaluated positively before her background became known, which helped validate her sense that she had earned her place at Fort Mason through her own efforts. Dr. Santos stopped by Sarah's station later that day to discuss the opportunities that Colonel Patterson had described. "Sarah, I've worked with some of the special operations medical teams that Patterson mentioned, and they represent some of the most challenging and rewarding assignments in military medicine. If you're interested in pushing yourself to the absolute limits of your capabilities, those opportunities could be incredible." The conversation with Dr. Santos helped Sarah understand that the special assignments weren't just recognition of her family background, but genuine opportunities to apply her skills in the most demanding environments military medicine had to offer. This perspective helped her see the offers as professional development, rather than attempts to trade on her father's reputation. As Sarah's shift ended and she prepared to leave Fort Mason, she reflected on how fundamentally her situation had changed in the course of a single day. The recognition of her clinical capabilities had been deeply satisfying, but the revelation of her family background had created new expectations and opportunities that would require careful consideration. That evening, Sarah sat in her apartment, reviewing the day's events and trying to process the career decisions she now faced. The special assignment opportunities represented exactly the kind of challenging, meaningful work that had originally drawn her to nursing, but they also meant embracing the military medical career path she had thought she wanted to avoid. Her phone rang, interrupting her contemplation, and she was surprised to see her father's number on the display. General Mitchell rarely called during weekday evenings unless something significant had occurred, and Sarah wondered if news of the day's events had somehow reached him. "Sarah, I got an interesting call today from an old colleague at Fort Carson," her father said without preamble. "It seems my daughter has been making quite an impression in her new position." Sarah felt a mixture of pride and apprehension as she realized that news of her performance and the subsequent opportunities had traveled through military medical channels to reach her father. "Dad, I hope you know that I never used your name or reputation to advance my position at Fort Mason. Everything I've accomplished has been based on my own work." "I never doubted that for a second," General Mitchell replied, his voice filled with unmistakable pride. "But Sarah, I want you to understand something important. Your mother and I have always supported whatever career path you chose, but hearing about your performance during that crisis situation and the recognition you've earned, I have to say that military medicine seems to be bringing out the best in your capabilities." The conversation with her father helped Sarah understand that the opportunities she was considering weren't about trading on family connections, but about finding the environment where her unique combination of skills and background could have the greatest impact. Military medicine, she was beginning to realize, might not be the compromise of her independence she had feared, but rather the perfect application of everything that made her who she was. Over the following days, Sarah found herself evaluating the special assignment opportunities with increasing interest. The more she learned about the positions and the kind of work they would involve, the more she recognized that they represented exactly the kind of challenging, meaningful career she had always envisioned for herself. Dr. Hartford called her into his office for a final conversation about her future at Fort Mason. "Mitchell, I want you to know that whatever you decide about these special opportunities, working with you has been one of the most rewarding professional experiences I've had in years. You've reminded me why I chose military medicine in the first place." The comment was perhaps the highest praise Sarah had ever received, coming from someone whose standards were legendarily high and whose approval was notoriously difficult to earn. More than any formal recognition or special assignment offer, Dr. Hartford's personal acknowledgement of her contributions validated her sense that she had found her true calling in military medicine. As Sarah prepared to make her decision about the future, she realized that her journey at Fort Mason had transformed her understanding of herself and her capabilities. She had proven that she could excel in the most demanding medical environments, had earned the respect of colleagues whose approval was not easily won, and had discovered that her family background was not a burden to overcome, but a foundation that enhanced her professional effectiveness. The young woman who had walked through the doors of Fort Mason Medical Center just weeks earlier, determined to prove herself independently of her family legacy, had evolved into a confident medical professional who understood that her unique background was not a limitation, but a strength that could be applied to serve others in the most meaningful ways possible. 3 weeks after the mass casualty event, Sarah's life at Fort Mason had transformed in ways she never could have anticipated. The respect she had earned during the crisis had solidified into genuine professional relationships, and her colleagues now sought her input on complex cases with the same deference they showed to seasoned military medical personnel. Dr. Hartford's evaluation reports consistently praised her clinical judgment and leadership potential, marking a complete reversal from his initial skepticism about civilian nurses working in military environments. The emergency department had returned to its normal rhythm of controlled urgency, but Sarah noticed that her role within the team had fundamentally evolved. She was no longer the newcomer being tested and evaluated. She had become an integral part of the medical staff whose opinions carried weight in treatment decisions and protocol discussions. When younger nurses or medical students rotated through the department, Sarah found herself in the position of mentor and teacher, sharing the lessons she had learned about adapting to military medical culture while maintaining excellence in patient care. During one particularly busy morning shift, Sarah was supervising a recent nursing school graduate who reminded her of herself just a few months earlier. The young woman was struggling with the intensity and precision demanded by military medical protocols, and Sarah could see the self-doubt and anxiety that came from trying to prove oneself in such a demanding environment. "Remember that everyone here wants you to succeed," Sarah told her during a quiet moment between cases. "The standards are high because the stakes are high, but that doesn't mean you're expected to be perfect immediately. Focus on doing your best work and learning from every experience, and you'll find your place here just like I did." The conversation reminded Sarah of how much she had grown since her first uncertain days at Fort Mason. The young nurse she was mentoring faced the same challenges Sarah had confronted, but Sarah now possessed the experience and confidence to guide someone else through the adaptation process. This shift from student to teacher represented a profound change in her professional identity and her sense of belonging within the military medical community. Corporal Rodriguez had become one of Sarah's closest colleagues, and their friendship had evolved into a professional partnership that enhanced both of their capabilities. During complex trauma cases, they worked together with an efficiency that came from mutual respect and shared understanding of each other's strengths. Rodriguez often commented that Sarah's civilian medical background brought perspectives and techniques that complemented traditional military approaches, creating more comprehensive patient care. "You know what I appreciate most about working with you," Rodriguez said during one of their conversations. "You never lost the compassion and patient advocacy that civilian medicine emphasizes, but you learned to apply it within military structure and protocols. That combination makes you incredibly effective in ways that pure military or pure civilian training might not achieve." The observation helped Sarah understand that her journey at Fort Mason hadn't required abandoning her civilian nursing values, but rather learning to express them within a different cultural framework. The skills and perspectives she had developed through her nursing education remained valuable. She had simply learned to apply them in new ways that served military patients and mission requirements. Dr. Santos had become both a colleague and a friend, and their professional relationship demonstrated how civilian and military medical personnel could collaborate effectively when mutual respect and shared commitment to excellence guided their interactions. During complex cases, Santos often asked for Sarah's input on treatment decisions, recognizing that her unique background provided insights that enhanced overall patient care. "Sarah, I've been thinking about recommending you for the Advanced Trauma Certification Program," Santos mentioned during one of their case reviews. "Your performance during emergency situations has been exceptional, and I think formal recognition of your skills would be valuable both for your career development and for our department's capabilities." The suggestion represented another milestone in Sarah's professional growth at Fort Mason. Advanced trauma certification was typically reserved for military medical personnel with extensive experience, and being recommended for such training indicated that her colleagues viewed her as a long-term asset to the military medical community rather than a temporary civilian employee. As Sarah considered the certification opportunity, she realized that her career path was evolving in directions she hadn't originally planned, but that felt increasingly right for her personal and professional goals. Military medicine was providing challenges and opportunities that civilian healthcare settings might not offer, and she was discovering capabilities within herself that she hadn't known existed. The relationship between Sarah and Nurse Wong had evolved from professional supervision to collegial respect, with Wong increasingly relying on Sarah's judgment and expertise during complex situations. Wong's feedback had shifted from critical evaluation to constructive guidance, and she often included Sarah in administrative discussions about department operations and policy development. "Mitchell, I want you to know that having you on our team has elevated our overall capabilities," Wong said during one of their regular evaluation meetings. "Your clinical skills are excellent, but more importantly, your approach to patient care and team collaboration has set a standard that benefits everyone in this department." The recognition from Wong was particularly meaningful because it came from someone who understood both civilian and military medical cultures and could evaluate Sarah's contributions within both contexts. Wong's approval represented validation that Sarah had successfully bridged the gap between different medical environments while maintaining the highest standards of professional performance. Dr. Hartford's transformation in his interactions with Sarah had been perhaps the most dramatic change in her Fort Mason experience. The skeptical, demanding supervisor who had once questioned her every decision had evolved into a mentor who sought her input on challenging cases and included her in strategic planning discussions about department development. "Mitchell, I owe you an apology," Dr. Hartford said during a private conversation in his office. "When you first arrived here, I assumed that civilian nurses couldn't adapt effectively to military medical requirements. Your performance has proven me wrong, and I've learned that excellence in patient care transcends the boundaries between civilian and military training." The acknowledgement from Dr. Hartford represented more than personal validation. It demonstrated that military medical culture could evolve and adapt when presented with evidence that challenged traditional assumptions. Sarah's success had opened doors for future civilian medical personnel, while proving that diversity in background and training could strengthen rather than weaken military medical capabilities. As spring turned to summer at Fort Mason, Sarah received an unexpected visitor that would change her perspective on her achievements and future opportunities. She was completing her morning rounds when Nurse Wong approached her with an expression that mixed professional formality with personal curiosity. "Mitchell, there's someone here to see you," Wong said, her tone suggesting this wasn't a routine visit. "He's waiting in the administrative conference room, and he specifically asked to speak with you about your background and qualifications." Sarah felt a flutter of curiosity as she wondered who might want to discuss her work in such a formal setting. She had received positive feedback from supervisors and colleagues, but the administrative nature of this request suggested something more significant than routine performance evaluation. The administrative wing of Fort Mason was a section Sarah rarely visited, filled with offices occupied by senior military personnel responsible for hospital operations and strategic planning. The formal atmosphere reinforced her sense that whatever was about to happen represented something important for her career and future opportunities. Colonel William Patterson was waiting in the conference room, his distinguished appearance and numerous military decorations indicating extensive service and high-level responsibilities. When Sarah entered, he stood and extended his hand with a warm smile that immediately put her at ease despite the formal circumstances. "Miss Mitchell, thank you for taking the time to meet with me," he said, his voice carrying authority tempered with genuine warmth. "I'm Colonel Patterson from Fort Carson, and I wanted to speak with you about your exceptional performance and some opportunities that have become available." Sarah accepted his handshake while trying to understand why someone from outside Fort Mason would be interested in her work. "Thank you, sir, but I'm not sure I understand why my performance would be of interest to personnel from other installations." Colonel Patterson gestured for her to sit, then took a seat across from her, at the polished conference table. "Miss Mitchell, your reputation has spread beyond Fort Mason. The reports I've received describe clinical excellence combined with exceptional adaptability to military medical culture, qualities that are highly valued throughout military medical command." The mention of her reputation extending beyond Fort Mason surprised Sarah, who had focused entirely on establishing herself within her immediate work environment. She was beginning to understand that this meeting represented opportunities she hadn't anticipated when she first started her position. "Miss Mitchell, before we discuss potential opportunities, I need to ask you some questions about your background and family history," Patterson continued. "Your personnel file contains basic information, but I'm interested in understanding the experiences that have shaped your approach to military medicine." Sarah felt her heart rate increase as the conversation took an unexpected turn toward personal information. She had been careful to keep her family background separate from her professional identity, preferring to be evaluated based on her own achievements rather than any connections to military culture. "I'm not sure what aspects of my background would be relevant to career opportunities," Sarah said carefully. "My nursing qualifications and performance evaluations should contain the professional information that would be pertinent to any positions you might be considering." Colonel Patterson leaned forward slightly, his expression becoming more serious. "Miss Mitchell, several people have mentioned that you seem unusually knowledgeable about military culture and protocol for someone with a civilian nursing background. Your ability to communicate effectively with military personnel and understand the unique aspects of military medical care suggests experiences that go beyond professional training." Sarah realized that her natural familiarity with military terminology and culture, developed through years of growing up in a military family, had been more apparent than she had intended. She had tried to downplay this background, but it seemed that her instinctive understanding of military life had emerged naturally during her work at Fort Mason. "My father served in the military," Sarah admitted, recognizing that further evasion would be inappropriate given the formal nature of this conversation. "I grew up in a military family, so I'm familiar with military culture and terminology. But I've worked hard to succeed here based on my nursing qualifications rather than my family background." Colonel Patterson's expression shifted in a way that suggested Sarah's answer had provided exactly the information he was seeking. "Miss Mitchell, what was your father's name, rank, and unit of service? This information is relevant to the opportunities I'm here to discuss." The specificity of the question made Sarah uncomfortable, as she sensed that revealing this information would fundamentally change how she was perceived, both at Fort Mason and within broader military medical circles. She had worked hard to establish her professional identity independently, and she was reluctant to have her achievements attributed to family connections rather than personal competence. "With respect, sir, I don't understand why my father's service record would be relevant to my nursing career or any opportunities you might be considering," Sarah said, trying to maintain professional courtesy while protecting the independence she had worked so hard to establish. Colonel Patterson stood and walked to the window, looking out at the Colorado mountains before turning back to face Sarah. "Miss Mitchell, I think there's been a misunderstanding about the purpose of this meeting. I'm not here to offer you opportunities based on family connections. I'm here because your individual performance has attracted attention at the highest levels of military medical command." Sarah felt a mixture of relief and continued confusion as she processed this unexpected information. "I appreciate the recognition, but I still don't understand why my family background would be relevant to that kind of professional attention." "Because," Patterson said, returning to his seat with a more relaxed posture. Military Medical Command is always interested in understanding what creates exceptional performance. Your combination of clinical excellence and cultural adaptability is exactly what we look for in personnel we want to develop for leadership positions. The conversation was moving in directions Sarah hadn't anticipated, and she was beginning to suspect that this meeting would have implications far beyond simple recognition of her recent performance. Patterson's persistent interest in her family background seemed too specific to be casual curiosity about her success. Miss Mitchell, I'm going to ask you one more time about your father's military service, and I hope you'll trust me enough to provide complete information. The opportunities I'm here to discuss will be much more meaningful if we can establish the full picture of your background and qualifications. Sarah took a deep breath, recognizing that continued evasion would be both futile and potentially counterproductive to her career development. My father is General Robert Mitchell. He served multiple combat deployments in Afghanistan and Iraq, and he was awarded the Medal of Honor for actions during Operation Enduring Freedom. The silence that followed Sarah's revelation was profound. Colonel Patterson's expression transformed, from professional curiosity to something approaching amazement, and Sarah could see that this information had fundamentally changed the context of their entire conversation. General Robert Mitchell is your father? Patterson asked, his voice reflecting genuine surprise mixed with deep respect. Miss Mitchell, do you understand the significance of this? Your father is one of the most decorated and respected military leaders of his generation. Sarah felt the familiar mixture of pride and burden that always accompanied discussions of her father's military achievements. She was enormously proud of his service and sacrifice, but she had always struggled with living up to the expectations that came with being the daughter of such a distinguished military leader. Yes, I'm aware of my father's distinguished service, Sarah said quietly. But I chose civilian nursing specifically because I wanted to establish my own professional identity rather than following directly in his footsteps. I've worked hard to succeed based on my own merits and capabilities. Colonel Patterson leaned back in his chair, his expression thoughtful as he processed the implications of Sarah's family connection. Miss Mitchell, I think you may have misunderstood something fundamental about military culture. Your father's service doesn't diminish your own achievements. It provides context for understanding the exceptional standards you've internalized and the unique perspective you bring to military medicine. Before Sarah could respond, the conference room door opened and Dr. Hartford entered, his expression suggesting he had been invited to join this conversation at a predetermined time. Sarah felt her anxiety increase as she wondered what role her supervisor would play in whatever was developing from this unexpected meeting. Colonel Patterson, Dr. Hartford, Sarah said, acknowledging both men while trying to understand the dynamics of this expanding conversation and what it might mean for her future at Fort Mason. Dr. Hartford took a seat at the conference table, his usual stern expression replaced by something that looked distinctly like admiration and respect. Mitchell, Colonel Patterson has shared some remarkable information about your family background. I have to admit, this explains quite a bit about your exceptional performance and rapid adaptation to our environment. Sarah felt a sinking sensation as she realized that her carefully maintained professional separation from her family's military legacy was dissolving before her eyes. Dr. Hartford, I hope you understand that I never intended to conceal this information inappropriately. I simply wanted to be evaluated based on my nursing qualifications rather than my family connections. Your desire to succeed independently is not only admirable but exactly what we would expect from someone with your background, Dr. Hartford replied, his tone more respectful than Sarah had ever heard from him. But now that we understand your heritage, your exceptional performance during crisis situations and your intuitive understanding of military culture make complete sense. Colonel Patterson cleared his throat, regaining control of the conversation. Miss Mitchell, the reason I'm here is to offer you opportunities that reflect both your demonstrated clinical excellence and your unique qualifications for military medical service. Based on your performance and your background, several positions have become available that would utilize your skills in ways that could significantly impact military medical capabilities. Sarah felt her professional world shifting as she tried to process the implications of what was being offered. She had come to Fort Mason seeking a challenging civilian nursing position, and now she was being presented with opportunities that would fundamentally change the trajectory of her entire career. "What kind of positions are you considering?" Sarah asked, recognizing that she needed more specific information before she could even begin to evaluate such significant career opportunities. "Advanced military medical assignments that require not just clinical excellence, but also the kind of cultural understanding and leadership potential that you've demonstrated," Patterson explained. "Positions with special operations medical teams, combat support hospitals in challenging environments, training programs for military medical personnel, leadership roles in military medical development." The scope of opportunities being described was both flattering and overwhelming, representing recognition of her capabilities, while also pulling her toward exactly the kind of military medical career path she had thought she wanted to avoid when she first chose nursing. Sarah looked between Colonel Patterson and Dr. Hartford, trying to understand how this conversation had evolved so quickly from routine performance feedback to life-changing career opportunities that would affect every aspect of her professional and personal future. "This is quite a lot to process," Sarah said honestly. "I appreciate the recognition and the confidence you're showing in my capabilities, but I need time to consider what these opportunities would mean for my career goals and personal plans." Dr. Hartford spoke up, his voice carrying an unusual tone of respect and genuine encouragement. "Mitchell, I want you to know that regardless of what you decide about these special opportunities, your position here at Fort Mason is not only secure but highly valued. You've proven yourself to be exactly the kind of medical professional we need most, and we would be honored to have you continue as part of our team for as long as you choose to stay." The transformation in Dr. Hartford's attitude was remarkable, and Sarah realized that learning about her family background had completely changed how he viewed her contributions and potential. While she appreciated the recognition, she also felt somewhat conflicted that this change seemed to depend more on her father's reputation than her own demonstrated capabilities. Colonel Patterson stood, indicating that the formal portion of their meeting was concluding. "Miss Mitchell, I don't need an answer today, but I hope you'll seriously consider the opportunities we've discussed. Military medicine needs people with your combination of clinical skills, cultural understanding, and leadership potential. Take whatever time you need to make your decision." As the meeting ended and Sarah made her way back to the emergency department, she felt overwhelmed by the rapid transformation of her professional situation. In the span of a single conversation, she had gone from being a civilian nurse, proving her worth, to being recognized as someone with exceptional potential for the highest levels of military medical service. The news of Sarah's family background spread through Fort Mason with the speed that characterized all significant information in military communities. Sarah noticed that her colleagues' reactions were more complex than simple admiration for her father's distinguished service. Some staff members seemed to view her with increased respect and understanding, while others appeared to question whether her recent success had been based on merit or family connections. Nurse Wong approached Sarah during the afternoon shift, with an expression that mixed professional respect with personal curiosity, and perhaps a touch of newfound understanding. "Mitchell, I have to admit that learning about your family background explains quite a bit about your adaptation to our environment and your intuitive understanding of military medical culture. But I want you to know that your performance during our recent crisis earned my respect and admiration before anyone knew about your father's service." The comment was deeply meaningful to Sarah because it acknowledged both her family legacy and her individual achievements. She appreciated Wong's recognition that her clinical performance had been evaluated positively based on its own merits, which helped validate her sense that she had earned her place at Fort Mason through her own efforts and capabilities. Dr. Santos stopped by Sarah's station later that day to discuss the opportunities that Colonel Patterson had described, and to offer her perspective on the career paths being presented. Sarah, I've worked with some of the special operations medical teams and advanced military medical programs that Patterson mentioned, and they represent some of the most challenging and rewarding assignments available in military medicine. If you're interested in pushing yourself to the absolute limits of your clinical and leadership capabilities, those opportunities could be incredible for your professional development. The conversation with Dr. Santos helped Sarah understand that the special assignments weren't just recognition of her family background, but genuine opportunities to apply her skills in the most demanding and impactful environments that military medicine had to offer. This perspective helped her see the offers as professional development opportunities rather than attempts to trade on her father's reputation. As Sarah's shift ended and she prepared to leave Fort Mason for the day, she reflected on how fundamentally her situation had changed in the course of a few hours. The recognition of her clinical capabilities had been deeply satisfying, but the revelation of her family background had created new expectations and opportunities that would require careful consideration and thoughtful decision-making. That evening, Sarah sat in her apartment reviewing the day's events and trying to process the career decisions she now faced. The special assignment opportunities represented exactly the kind of challenging, meaningful work that had originally drawn her to nursing, but they also meant embracing the military medical career path she had thought she wanted to avoid in order to establish her own professional identity. Her phone rang, interrupting her contemplation, and she was surprised to see her father's number on the display. General Mitchell rarely called during weekday evenings unless something significant had occurred, and Sarah wondered if news of the day's events had somehow reached him through military channels. "Sarah, I got an interesting call today from an old colleague at Fort Carson," her father said without preamble, his voice reflecting both pride and curiosity. "It seems my daughter has been making quite an extraordinary impression in her new position, and some significant opportunities are being presented to you." Sarah felt a mixture of pride and apprehension as she realized that news of her performance and the subsequent opportunities had traveled through military medical channels to reach her father. "Dad, I hope you know that I never used your name or reputation to advance my position at Fort Mason. Everything I've accomplished has been based on my own work and dedication." "I never doubted that for a second," General Mitchell replied, his voice filled with unmistakable pride and confidence. "But Sarah, I want you to understand something important. Your mother and I have always supported whatever career path you chose. But hearing about your performance during crisis situations and the recognition you've earned, I have to say that military medicine seems to be bringing out the very best in your capabilities and character." The conversation with her father helped Sarah understand that the opportunities she was considering weren't about trading on family connections, but about finding the environment where her unique combination of skills, background, and dedication could have the greatest positive impact on others and on important missions. Over the following days, Sarah found herself evaluating the special assignment opportunities with increasing interest and excitement. The more she learned about the positions and the kind of work they would involve, the more she recognized that they represented exactly the kind of challenging, meaningful career she had always envisioned for herself, even if the path to get there had been different than she originally planned. Dr. Hartford called her into his office for a final conversation about her future at Fort Mason and the broader opportunities being presented to her. "Mitchell, I want you to know that whatever you decide about these special opportunities, working with you has been one of the most rewarding and educational professional experiences I've had in my entire career. You've reminded me why I chose military medicine in the first place, and you've shown me that excellence can come from unexpected places and backgrounds." The comment was perhaps the highest praise Sarah had ever received, coming from someone whose standards were legendarily high and whose approval was notoriously difficult to earn. More than any formal recognition or special assignment offer, Dr. Hartford's personal acknowledgement of her contributions validated her sense that she had found her true calling in military medicine. As Sarah prepared to make her decision about the future, she realized that her journey at Fort Mason had fundamentally transformed her understanding of herself and her capabilities. She had proven that she could excel in the most demanding medical environments, had earned the respect of colleagues whose approval was not easily won, and had discovered that her family background was not a burden to overcome, but a foundation that enhanced her professional effectiveness and potential for leadership. The young woman who had walked through the doors of Fort Mason Medical Center just months earlier, determined to prove herself independently of her family legacy, had evolved into a confident medical professional who understood that her unique background was not a limitation, but a strength that could be applied to serve others in the most meaningful and impactful ways possible. Sarah's decision, when it came, felt both inevitable and exactly right. She would accept the special assignment opportunities, not because of her family connections, but because they represented the perfect application of everything she had learned about herself and her capabilities during her transformative experience at Fort Mason Medical Center. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.